Assalamu alaikum. You are watching Jameel TV. Your host, your friend Jameel Ahmed, is here with another vlog regarding seasonal affective disorder. Nowadays, I have seen many friends and relatives suffering from sadness and lack of sleep, lack of appetite, and other uncomfortable situations, which makes their life very difficult. So I search it and try to know the reasons and how to control and what is the prevention of it. So I found this article: seasonal affective disorder is a type of depression that is related to changes in season. It is also called SAD. SAD begins and ends at about the same times every year. If symptoms start in the fall and continue into the winter months, sapping your energy and making you feel moody, these symptoms often resolve during the spring and summer months. Treatment for SAD may include light therapy, phototherapy, psychotherapy, and medications. Don't brush off that yearly feeling as a simply case of the winter blue or seasonal funk that you have to tough out on your own. Take steps to keep your mood and motivation steady throughout the year. What are the symptoms of this SAD? In most cases, seasonal affective disorder symptoms appear during late fall or early winter and go away during the sunnier days of spring and summer. Less commonly, people with the opposite pattern have symptoms that begin in summer or spring. In either case, symptoms may start out as mild and become more severe as the season progresses. Signs and symptoms of SAD may include feeling listless, sad, or down most of the day, nearly every day, losing interest in activities you once enjoyed, having low energy and feeling sluggish, having problem with sleeping too much, experiencing carbohydrate cravings, overeating and weight gain, having difficulty concentrating, feeling hopeless, worthless, or guilty, having thoughts of not wanting to live. Fall and winter SAD. Symptoms specific to winter onset SAD, sometimes called winter depression, which may include oversleeping, appetite changes, especially a craving for food high in carbohydrates, weight gains, tiredness, or low energy. Spring and summer SAD. Symptoms specific to summer onset seasonal affective disorder, sometimes called summer depression, which may include trouble in sleeping, insomnia, poor appetite, weight loss, agitation or anxiety, increased irritability, seasonal changes, and bipolar disorder. People who have bipolar disorder are at increased risk of seasonal affective disorder. In some people with bipolar disorder, episodes of mania may be linked to a specific season. For example, spring and summer can bring on symptoms of mania or a less intense form of mania, hypomania, anxiety, agitation, and irritability. They may also experience depression during the fall and winter months. So, when to see a doctor? It is normal to have some days when you feel down. But if you feel down for days at a time, and you cannot get motivated to do activities you normally enjoy, see your healthcare provider. This is especially important if your sleep patterns and appetites have changed. You turn to alcohol or tranquilizer for comfort or relaxation, or you feel hopeless or think about suicide. Causes. When we see the causes, the specific cause of seasonal affective disorder remains unknown. Some factors that may come into play include your biological clock, circadian rhythm. The reduced level of sunlight in fall and winter may cause winter onset SAD. This decrease in sunlight may disrupt your body's internal clock and lead to feelings of depression. Serotonin levels. A drop in serotonin, a brain chemical neurotransmitter that affects mood, might play a role in SAD. Reduced sunlight can cause a drop in serotonin that may trigger depression. Melatonin levels. The change in season can disrupt the balance of the body level of melatonin, which plays a role in sleep pattern and mood. What are the risk factors in this? Seasonal affective disorder is diagnosed more often in women than in men. The SAD occurs more frequently in younger adults than in older adults. Factors that may increase your risk of seasonal affective disorder may include family history. People with SAD may be more likely to have blood relatives with SAD or another form of depression. Having major depression or bipolar disorder. Symptoms of depression may worsen seasonally if you have one of these conditions. Living far from the equator. SAD appears to be more common among people who live far north or south of the equator. This may be due to decreased sunlight during the winter and longer days during the summer months. Low level of vitamin D. Some vitamin D is produced in the skin which is exposed when it is exposed to sunlight. Vitamin D can help to boost serotonin activity. Less sunlight and not getting enough vitamin D from foods and other sources may result in low level of vitamin D in the body. What complication can be occurred? Take signs and symptoms of seasonal affective disorder seriously. As with other types of depression, SAD can get worsen and lead to problems if it is not treated. These can include social withdrawal, school or work problems, substance abuse, other mental health disorders such as anxiety or eating disorder, suicidal thought or behavior. What is the prevention? There is no known way to prevent the development of seasonal affective disorder. However, if you take steps early on to manage symptoms, you may be able to prevent them from getting worse over time. You may be able to head off serious changes in mood, appetite, and energy levels, as you can predict the time of the year in which these symptoms may start. Treatment can help prevent complications, especially if SAD is diagnosed and treated before symptoms get bad. Some people find it helpful to begin treatment before symptoms would normally start in the fall or winter, and then continue treatment past the time symptoms would normally go away. Other people need continuous treatment to prevent symptoms from returning. So, I hope it will be helpful for you all. Thank you very much for watching my video so patiently. Hope you will like it and share with your friends. Keep watching Jameel TV. Please also subscribe my channel to promote it. Jazakallah.